Okay, this is Chapter 8 of the ATI, Pharmacology, bipolar disorders. Bipolar disorders are primarily managed with mood-stabilizing medications like lithium carbonate. Other medications used to treat bipolar disorders include anti-epileptic drugs, AEDs, valproic acid, carbamazepine, lamotrigine, oxcarbazepine, and topiramate. Atypical antipsychotics, olanzapine, can be useful in early treatment to promote sleep and to decrease anxiety and agitation. These medications also demonstrate mood-stabilizing properties. Antipsychotics approved for treatment of bipolar depression include lurasidone and quetiapine, and a combination medication that includes olanzapine and fluoxetine. Analytics like clozapam and lorazepam can be useful in treating acute mania and managing the psychomotor agitation often seen in mania. Antidepressant medications, bupropion and sertraline, can be useful during the depressive phase. These are typically prescribed in combination with the mood stabilizer to prevent rebound mania. Bipolar disorder is primarily managed with mood-stabilizing medications, lithium. Bipolar disorder can be treated with certain anti-epileptic medications. Antipsychotics. These can be useful in early treatment to promote sleep and to decrease anxiety and agitation. These medications also demonstrate mood-stabilizing properties. This is valproic acid, carbamazepine, lamotrigine, oxcarbazepine, and topiramate. Analytics like clozapam and lorazepam can be useful in treating acute mania and managing the psychomotor agitation often seen in mania. Antidepressants is bupropion, venlafaxine, and selective SSRIs are useful during the depressive phase. These are typically prescribed in combination with the mood stabilizer to prevent rebound mania. Lithium produces neurochemical changes in the brain, including serotonin receptor blockade. There is evidence that the use of lithium can show a decrease in neuronal atrophy and/or an increase in neuronal growth. Lithium is used in the treatment of bipolar disorders. Lithium controls episodes of acute mania and helps prevent the return of mania or depression. Effects with therapeutic lithium levels, some resolve within a few weeks. This is complications. GI distress, fine hand tremors, and polyuria and mild thirst. Weight gain and renal toxicity, goiter and hypothyroidism, bradydysrhythmias, hypotension, and electrolyte imbalances. Lithium toxicity, the common adverse effect, the lithium level is below 1.5. Early indications is lithium level 1.5 and greater. Manifestations is ongoing GI distress, including nausea, vomiting, and diarrhea, confusion, poor coordination, coarse tremors, and sedation. Severe toxicity is greater than 2.5, and this is oliguria, seizures, rapid progression of manifestations leading to coma and death. Not recommended for use during pregnancy. It's contraindicated for lactation. Use cautiously in clients who have renal dysfunction, heart disease, sodium depletion, hypovolemia, schizophrenia, or dehydration. Use cautiously in older adult clients and clients who have thyroid disease, seizure disorder, or diabetes. Interactions is diuretics. Sodium is excreted with the use of diuretics. Reduced blood sodium decreases lithium excretion, which can lead to toxicity. NSAIDs. Ibuprofen and celecoxib. Concurrent use will increase renal reabsorption of lithium, leading to toxicity. And anticholinergics. Antihistamines and TCAs can induce urinary retention and polyuria, leading to abdominal discomfort. The nursing administration is monitor plasma lithium levels during treatment. Obtain lithium level with each dose change and after beginning lithium therapy every 2 to 3 days. Older adult clients often require more frequent monitoring because of increased risk of toxicity. Lithium blood levels should be obtained in the morning, 10 to 12 hours after the last dose. Severe toxicity is care for clients who have advanced or severe lithium toxicity in an acute care setting and provide supportive measures. Hemodialysis can be indicated. Okay, so now on to mood-stabilizing anti-epileptics. These are carbamazepine, valproic acid, and lamotrigine. Oxcarbazepine and topiramate are less frequently used and are recommended for maintenance treatment of bipolar disorder. Expected action. Help treat and manage bipolar disorders by various mechanisms, slowing the entrance of sodium and calcium back into the nerve to return to its active state. Potentiating and inhibitory effects of GABA, inhibiting glutamate acid, which in turn suppresses the CNS excitation. Complications of carbamazepine. CNS effects. This is cognitive function is minimally affected, but CNS effects can include nystagmus, double vision, vertigo, staggering gait, and headache. Blood dyscrasias. This is leukopenia, anemia, and thrombocytopenia. It's heterogenic, so avoid use in pregnancy, and it's hypoosmolality. It promotes secretion of ADH, which inhibits water excretion by the kidney and places clients who have heart failure at risk for fluid overload. Skin disorders such as dermatitis and rash and Stevens-Johnson syndrome. Hepatotoxic, it's evidenced by anorexia, nausea, vomiting, fatigue, abdominal pain, and jaundice. Lamotrigine is double vision, dizziness, headache, nausea, and vomiting. And valproic acid is GI effects, nausea, vomiting, indigestion. It's hepatotoxic and pancreatitis and thrombocytopenia. This is autotetragenic and weight gain. Contraindications. Pregnancy. Carbamazepine should be used only if the benefits to the client outweigh the risks of the fetus. Recommend vitamin K during the last week of pregnancy. Lamotrigine may increase the risk of cleft lip palate if used during the first trimester. Valproic acid should be avoided during pregnancy. It can be used for migraines. The therapeutic blood level for carbamazepine is 4 to 12, and the therapeutic blood level for valproic acid is 50 to 125. Interactions with carbamazepine. Oral contraceptions and warfarin, grapefruit juice, phenytoin and phenobarbital. Interactions for lamotrigine is carbamazepine, phenytoin, and phenobarbital, valproic acid, and oral contraceptives. Valproic acid, the contraindications is phenytoin and phenobarbital. Nursing evaluations of medication effectiveness, relief of manifestations of acute mania, mood stability, ability to perform ADLs, improve sleeping and eating habits. Antipsychotics is